So yes, next up we're talking about things we don't know as much about, and now moving on to a topic where we think we have a ton of evidence, but as Dr. Demers tells us, the world is always changing. So we're now going to welcome Dr. Paul Demers, the director of the Occupational Cancer Research Centre based at Ontario Health, and a professor with the University of Toronto's Dalla Lana School of Public Health, as well as a clinical professor with the University of British Columbia's School of Population and Public Health. He has a PhD in epidemiology and a master's degree in occupational hygiene, and his research has focused primarily on occupational and environmental cancer, lung disease, and heart disease. He has been a member of many national and international expert panels and committees dealing with occupational and environmental cancer for organizations such as the International Agency for Research on Cancer, UN Environment Program, US National Toxicology Program, US Institute of Medicine Health Effects Institute, and the American Conference of Industrial Hygienists. I appreciate your being here, and welcome, and take it away.
Okay, thanks. So as you mentioned in your introduction, this is now for something completely different. When I was getting a hygiene degree back in the mid-1980s, I thought asbestos was an old issue back then, as I think people have heard me say at other talks, and yet it doesn't seem to go away. It still is, I believe, the biggest workplace killer in Canada, causing lots of fatal illnesses and lots of damage still. So today I'm going to talk a bit more about asbestos and talk a little bit about some of the various projects we're going in on. So I apologize for people who have seen talks on pieces of this before, but I'm trying to give a bit of an overview of what we currently know, at least for Ontario. A lot of talks these days ask for a conflict of interest slide, and I have no conflicts of interest to report, but I thought I'd take the opportunity also to thank various funders, ranging from our Ministry of Labor Training and Skills Development and WorkSafe BC, Ministry of Health. Lots of other folks have done this, and also to acknowledge a lot of the people who have been co-investigators with me on many different projects. Chris McLeod from UBC, Victoria Ardale from U of T, Anya Keefe, and I'll try to mention people as we go through this, and Nate DeBono, Giovanna Citran, and Tracy Kirkham, as well as a lot of different staff, and hopefully I haven't missed too many names there. Well, as probably everybody on this call will know, Canada was once one of the world's largest producers of asbestos, certainly also a very large per capita consumer of asbestos. In the 1970s and 80s, the use of asbestos in Canada, despite the fact that we continue to mine it and export it, began to be restricted. Occupational exposure limits were gradually dropped. Lots of things went into effect over the decades to try to reduce our exposure. By the early 1990s, mining outside of Quebec had stopped. There was mining actually in Ontario, Newfoundland, and British Columbia prior to that. In 2012, the last mine ceased operation, and then in 2018, we finally banned asbestos in Canada. So what I'm going to talk about today is what we know about the continuing impact of asbestos in Canada, more specifically even for Ontario. And after the ban, where should we go with prevention? Certainly, the ban is important. It's an important landmark for us. Many of us worked a long time to get the ban, but really it's more of a starting gun for a lot more prevention work that needs to go on. Now, this is the kind of maybe obvious picture of mesothelioma, and oftentimes we use mesothelioma as our marker for the impact of asbestos. And here you see mesothelioma cases in Canada over about a 25-year period from the mid-1990s or so on. The kind of orangey red line there represents Ontario. Even with a large province like Ontario, the dots represent how much things jump around each year. It's still a relatively rare cancer, which is good. You can see that Quebec has almost as many cases. Quebec ceased reporting their tumor registry data to the Canadian Cancer Registry, withdrew it back to 1910, I think for technical reasons, but they still haven't offered it again. So we don't know where their trend in cases is going. British Columbia is still rising in cases, and the rest of Canada appears to be leveling off the number of cases. So we did a project with the University of British Columbia to look at trends in both Ontario and BC. I'm going to just give you the BC trends now. This is probably the one piece of good news, even though it's mixed, is that the actual rates, even though the numbers are going up, the population keeps going up in Ontario. So the rates of mesothelioma have gradually leveled off in the last 10 years or so. And the gray line here represents the rates for all of Ontario, the blue line for males, and the kind of reddish line for women. What you'll notice is that for men it appears to even be dropping a little bit, although perhaps it's a little too soon to say that for certain. But when it comes to women, the rates are still slowly rising in Ontario. Now, pleural cancer, the lining of the lungs, is the most common form of mesothelioma. It's about 75 to 85% of all cases, depending upon which part of the world you're looking at, or even which part of Canada you're looking at. And certainly it drives our overall rates. And so you can see that on the left here, it's the rates for pleural cancer. On the right, I'd put peritoneal cancer. And peritoneal is mesotheliomas that arise for the lining of the digestive tract. And what you can see there is that they are still actually rising. And although traditionally the rates among women and men have been quite different, with women being much lower than men for mesothelioma all, and certainly for pleural, you can see that they're pretty close to each other in terms of peritoneal cancer. And there's some various reasons for that. One of which is that some people propose that peritoneal may be more related to the exposures that we get more environmentally. Maybe also that, as with women in pleural cancer, that just the rate among women is just gradually going up due to even some occupational exposure, as well as women are employed in exposed jobs too. The other thing that has changed is that people are getting diagnosed at a much more advanced age. The darkest line on the left and the right are the trends for the rates of mesothelioma among people over 80. So you can see in men, those rates have really climbed quite high. They were higher than the rates in younger people, even in the back in the 90s, but they've risen now to where they continue to grow, and the rates amongst people in, let's say, ages 60 and lower, but particularly ages 50 and lower, are not only much lower, but in men at least appear to be dropping. The rates amongst people in their 70s are also rising in both women and men, have also risen, I'd say, although perhaps they're leveling off a bit for men. So what this means is, it's bad for survival from mesothelioma, but it does mean that people are getting diagnosed at an older age, which may be related again to perhaps some of these cases being due to lower level exposures, maybe taking longer to develop, or other factors that we're not really sure of. But we're not alone in having seen this. This is being seen in other parts of the world, although maybe not this dramatically. I'm just giving you a map here because, in fact, everybody likes maps, I think, in terms of being able to visualize things. they're not always easy to interpret when you're dealing with cancer because where people are exposed might not necessarily be where they live 20, 30, 40 years later. Certainly when you look at Lambton County, which is where Sarnia is, it's had the highest rates of mesothelioma for some time. It has Holmes Foundry, a notorious workplace with high levels of exposure, as well as other exposures that probably occurred in the chemical industry and elsewhere. But I'll tell you that, in fact, their rates are not as different from the rest of Ontario as they once were. And it may be now that our rates are being driven more by people being exposed in things like construction, which is probably the predominant place where people get exposed, or people in construction, or people responsible for building maintenance and things like that. And that's more distributed across the province. So these kind of geographic differences may go down, although you do see Leeds and Grenville, which is the second highest, and Peterborough, which is somewhere in between. If you're wondering where Toronto is, the rate is just above 1 per 100,000, so it's much lower because the color codes get darker as it goes on. So they're nearer to the bottom of the list of different census divisions, which are fairly close to what our public health units are. So where are those cancers occurring? Ontario has something called the Asbestos Worker Registry, which is started back in the 1980s as a way of health monitoring for people exposed to asbestos. It's a mandatory registry that the employer is supposed to report workers who were exposed to what are called type 2 and type 3 activities. And people have questions, I can show you that, but you can find them on the Ministry of Labor site. Those are kind of high and moderate types of activities in terms of exposure that might occur for workers in the decades, recent decades. It was really oriented towards the construction sector, or construction trades, but it's actually over the years has broadened out a bit. We undertook a linkage of that registry to the health records of the province, and linked 26,000 workers who are in that registry to there, which is about 80% of the people that are currently in the registry. We were able to successfully link to hospital and outpatient records and tumor registry records. And this is at least the first shot of what I'm giving you from what we saw. Here are, you can see that they weren't, compared to the rest of the province, and that's what these are, these standardized incidence ratios, is the ratio of the adjusted rate of disease in the people who are in the registry compared to the rest of the province. Then you see a 95% confidence limit listed there. And the number of cancer cases, lung cancer, mesothelioma, that's all through the tumor registry, and then all of the respiratory diseases, which is through outpatient records, and as well as hospital discharge records and things like that. But what you see here is that even though the all cancer rate is not so different, lung cancer rate is somewhat elevated, and mesothelioma is quite a bit higher in this group, which means we're successfully identifying people in this asbestos worker registry who were exposed to asbestos. The overall rate of respiratory disease is higher, including chronic obstructive pulmonary disease and asbestosis. And what you see here at the bottom is pulmonary fibrosis, which was also highly elevated amongst people in the registry. And that's important. That may reflect kind of unrecognized lung disease due to asbestos. But remember, a lot of these folks are in the construction industry, so this may also be things like fibrotic lung disease from silica. So there might be also some silicosis in here. but this is simply pulmonary fibrosis. It's not including things that were labeled that way. Now, there is some overlap. People may have subsequently been diagnosed with asbestosis. We're looking at these things independently, but I think they're important to look at. The right-hand set of columns is for women, and we had many fewer women uh, in the registry than men. Perhaps that's expected in terms of the history of exposure to asbestos, but maybe not quite at the ratio that you see here. Despite the fact that there were less than 1,000 women there, we did see indications that they have at least as much, if not more, asbestos-related disease than the men in the registry. Sometimes the numbers are too small to report, as you see there. That's how few there were. But still, given that this is less than 1,000 women, I think that's an important thing to point out. Here you just see it broken down by construction versus manufacturing. And about 60% of the people that we linked were explicitly in the construction sector. It's important to remember that there are also a lot of building trades people, as well as other people who are potentially exposed in other places. But a lot of building trades people also are responsible for maintaining manufacturing facilities, even our schools and other types of buildings. So not everybody is in construction. What you see here is that at least for mesothelioma, asbestosis, you see quite high, higher rates in people who were in construction, but still quite elevated rates in people who were in manufacturing for all of these except for lung cancer. So it's not limited to construction alone, the impact. Now, the asbestos worker registry requires that the number of hours that people work with asbestos or exposed to asbestos be reported annually. It's not really the most complete reporting, I believe, and I think looking at the data, and the patterns that we see in the data, that's pretty easy to see. Although it's hard to tell without having to recontact people, which we're not allowed to do for privacy reasons. Here we've separated out the number of hours that were reported for individuals into low, medium, and high. And so what we're going to compare is the lowest third of the people who are in the registry to the medium and high groups. And what you can see is that the risk goes up amongst everybody in the registry with the number of hours that are reported for them. And this is true for lung cancer, for mesothelioma, for COPD, for asbestosis, and also for pulmonary fibrosis. So across the board, all of these things rise with the number of hours that are reported, even if we might be afraid that not all those hours are being captured. Now, the thing about the asbestos worker registry is it's groups that are, let's say, well recognized for having asbestos exposure. Their employers are reporting them. But it may not be everybody who's exposed to asbestos. We certainly think the numbers are quite a bit higher, and I'll get to that point in a little later. So we're also using our occupational disease surveillance system to look at the rates amongst different groups. And here you see the construction industry rates for both asbestosis and mesothelioma, and they support what you saw in the previous slide. These numbers, by the way, are from a paper published by Nate DeBono that was published earlier this year in the American Journal of Industrial Medicine. So it was Nate and a bunch of us are on that paper. But the important thing to recognize is that there are a number of other industries. Now I put asbestos mines and miscellaneous non-metallic mineral products up there first. That's because though miscellaneous non-metallic mineral products is actually the asbestos industries in Ontario. Both of those ceased long ago and certainly will never reopen again. But what you see here also is in manufacturing and primary metals, industrial chemicals. You also see increased risks. These are industries known to have used a lot of asbestos. I don't have all of them here. There are a number of different industries that were at elevated levels. But I do want to point out educational and related services. Uh, Now, it's not as dramatically increased as some of the others. I should point out that the ODSS, our surveillance system, is people who were formerly injured at work that were then following up to look at the development of disease over many years. And so in terms of educational services, it's primarily people um, who were not necessarily teachers, even though there are many more teachers in education. A lot of these folks are custodians, the skilled trades, and that's who many of these cases are arising in. Interestingly enough, the highest subsector there is colleges and universities. And for people who have followed the news over the last years, we heard about the University of Toronto and one of their buildings having a lot of asbestos being moved from there. We used a lot of asbestos in all of our educational institutions, all of our schools, universities, and things like that. Also all of our hospitals and many other buildings that were built, let's say, certainly prior to the 1980s, but certainly into the 1980s as well. So I want to jump now to asbestos management. And I want to talk about a report that Anya Keefe and I and Manisha Pawa and Soham Pranelkar. Soham was from University of British Columbia at the time. Manisha is with our center and is at McMaster University now. It was a report to assess the need for a national asbestos management standard that we prepared and was just released this year. So last year at October, Anya talked about the fact we were working on it, but we actually did have completed the report, delivered it. It's now available in both official languages from CSA. So here's some of the key gaps and challenges that we identified regarding asbestos management in Canada. I don't need to repeat all of these, but multiple legislative and regulatory frameworks. We have many different regulatory agencies responsible for everything from construction to disposal, lots of different areas and lots of different pieces of legislation. We were looking at issues of identification, assessment, control, training, a wide variety of issues that are involved in asbestos management. Now, I'm just going to show you a few. We actually looked at a lot of nitty-gritty. I'm going to encourage people to actually take a look at the report if you have a chance. But in preparing the report, we tried to look, and this is just one example. There are many tables in the appendix of this report looking at what the different practices of the different jurisdictions in Canada are. Here I just have the provinces and federal jurisdiction, which is the last one, CA. I've not included the territories because we just didn't have a mind to make it fit on this slide. What you can see here is that there is variability, and sometimes we identify gaps. So in terms of Ontario, analysis being done by accredited laboratories is not, we didn't see in the regulation. That may be because Ontario had its own laboratory when these regulations were written, and it was subsequently closed. I'll say that Ontario ranks better than most jurisdictions in Canada in most of the different things that we looked at, but there was no jurisdiction that really ranked overall good across all of the many different things that we looked at. And I'm only going to show you a few examples, but I encourage you to read the report. The report talks at a high level about what's needed and perhaps what's best, but it does not necessarily try to single out any jurisdiction. The idea here is that by developing an asbestos management standard, maybe we could provide better equal protection across the country in terms of asbestos management and move everybody up to the highest level. Here's another example. This is on asbestos inventories and requirements of different provinces and the federal jurisdiction. And again, you could see lots of variability, and Ontario is a bit in the middle here. I'm not showing you tables where Ontario is always at the top because just to show that we still have room to improve even here in Ontario. And here is a last one on exposure monitoring, and where you see where is exposure monitoring supposed to be required. So for area sampling and high risk activities, during moderate risk activities, the different types of things are supposed to be part of the monitoring. Location, frequency of sampling, and the analytical and methods used that are, so a lot of detail in this report. But this is again from the appendices. I don't think it's going to be, I think it's actually not that difficult of a report to read if you're really interested in the topic. Here's the conclusions and recommendations from the report. We did conclude that an asbestos management standard is needed in Canada to address inconsistencies in regulations and practices across the country, to establish minimum competency levels for anybody with a role in asbestos management, which we saw gaps in that in various jurisdictions across the country, and to support regulators' efforts to enforce compliance. We were a bit undecided in terms of whether we should go for a single standard or a suite of standards so that people could adopt different jurisdictions could adopt different pieces of that. That was something that we had a split in views from the experts that we interviewed. And we have some priorities there and say that we could actually leverage some existing standards that are out there. So what I wanted to kind of end with is to say that even as we've made a lot of progress on asbestos, we have a long way to go in terms of prevention, and that perhaps the ban is giving us a good opening to try to push at this point to improve the rest of our regulations regarding asbestos. And there are such a wide variety of regulations there. The asbestos management standard that CSA could create would be very helpful in pushing us to adopting best practices. One of the practices that I'd say is one of the things that's really quite a good thing in Ontario is that we have an asbestos worker registry. We're the only province that really has anything of that nature that has been around for a long time, and it really covers a number of people. I think that we should actually both enhance and expand that registry. I think we need to be proactive in trying to get people included, maybe try to increase the amount of information would make it helpful. I'm not going to offer specific recommendations, but this is a key way that we can get ahead of the game and try not to just wait for people to develop disease and then look at it afterwards, but instead try to know which groups we should be targeting for prevention, but also advise people when they've been exposed. We now have the beginning of lung cancer screening in the province, and currently asbestos exposure isn't one of the criteria, but we hope to make that one of the criteria to get people to be screened eventually. Having a asbestos worker registry would be very helpful with that. We also, I believe, need to explore more ways to proactively remove asbestos from our workplaces and really from everywhere in our environment. Certainly, we've had the belief that if it's not friable, if it's not being released into the air, that it's causing more harm to remove it. And yet we haven't removed a huge amount in the many decades, and meanwhile our buildings are gradually aging. So I think we need to think about ways to be more proactive in that area. In any case, I think we need to have a lot more discussion about moving prevention forward, and beyond just increasing awareness, which is always important. I think we need to take some very concrete steps. I'm just going to end there and thank the hosts for having me here today, and for you for attending.
Thanks, Paul. It's always a pleasure, and you prompted us with a lot to think about. And actually, we were considering Alec makes commentary and thanking Anya as well, who spoke last year. It wasn't quite all published about the presentation, but we did throw the links in for you, Paul, into the chat window, so folks can check it out in further detail. And we've been throwing around having a little bit of interaction, but we could throw it out now as well in our little Q&A. So any questions for Paul are welcome in the chat window. I did just want to pick up on some of your earlier commentary on, how would you enhance and expand the asbestos worker registry? And then for folks out there, while Paul's answering, if you might think about how you would like to see, how you'd like to see those management standards come from the CSA, if it would all lumped into one, or if you'd like to see them, one for, how to deal with waste, one how to deal with construction. If people could think about that and throw it in the chat window, that's more than welcome as well. So go ahead, Paul.
I guess in terms of the asbestos worker registry, because we cannot actually go back and talk to people, you can't say, oh, well, we missed this many years of somebody's history of asbestos exposure. But what you would see is a lot of people that would be sporadically being reported into the registry and have gaps in between. Also, it was just qualitative, but there was a point some years back when we first got a hold of the actual data in the registry, just to look through the phone book and look for people offering asbestos remediation. They weren't all reporting people into the registry. And so we know that there are gaps there. And maybe targeting that and trying to get people in. But also we should be looking at facilities, some of our older facilities where there is a lot of asbestos. One thing I didn't put in here is that Carrick's has upped its estimate of the number of people exposed in Ontario from 55,000 up to 77,000, and that's partially in recognition of people who are responsible for maintaining things like schools and other types of buildings. But in fact, when we've surveyed kind of CUPE members who are custodians for schools, there's a lot more people out there that at least are irregularly encountering asbestos as part of their work. And I think we've got to figure out a way to track folks like that maybe aren't getting exposed to asbestos every day, but are working in buildings where they could be a major issue.
Thanks, Paul. There is a question from Richard and then one from Kevin. I'll try to get to both. I think we have a bit of time, asking about the parallels in asbestos research and silica exposure research.
I think they're both kind of long-term challenges where we've known about them for a long time, maybe silica even longer, although we have known about asbestos really since the end of the 1800s. We started getting bad reports on that. There's still things that they're difficult to manage because they arise, unlike, you can't just substitute out very easily for many of these things. We can do that somewhat. I mean, now we're no longer even in that situation with asbestos. It's simply out there in a lot of places. And silica is also simply part of soil. It's going to be part of our mining. It's going to be part of construction no matter what we do. So they both have that kind of inherent challenge involved. And it means that we have to be proactive, and the control measures can be challenging. in those areas. And it's a matter of being kind of continually aware when we're in a situation that's generating particles into the air.
Great, thank you. And Kevin has a question more on exposure monitoring. That's a little bit deeper dive. If you want to go ahead, go ahead.
Yeah, sure. Thanks, Paul. As always, great presentation. And, you know, coming from Australia, it's just a quick comment, but then a question. You know, they've got Safe Work Australia, and I remember when I first became a hygienist, they had a code of practice for asbestos sampling and also for management of asbestos. And the legislation was quite tight and it was quite reasonably easy to understand. When I came to Canada, when I started to look at the legislation here, it was kind of very confusing. They talked about different processes and it was, anyway, that's a comment. So the question has to do with more with international scanning. I remember doing some work in New Caledonia years ago, and they were actually using the French protocol for sampling. And it might have changed now, I don't know, and I don't know if you've included it in your report, but you know, maybe something we can think about in the future with research, comparing the you know, the like microscopy sampling for asbestos with electron microscopy. I wonder, just with all the sampling that's been done, whether exposures have been missed because of the really, really fine fibers not being seen with the, you know, the phase contrast microscopy.
Yeah, I mean, electron microscopy is certainly much more sensitive, and as have very low levels of exposure, we know are challenging now. I think it certainly would be better. In this report, we didn't recommend specific things like that. We did look at some other jurisdictions, but a lot of it was really focused in on, even within Canada, how uneven things are. You know, challenge is that there's not many places outside of Quebec and Canada where there's a lot of sampling being done by workplace inspectors anymore. It's been downloaded to the employers, and that means that exposure data is kind of out of the public domain for us to be able to look at and actually track in the long term. This is a problem with really all exposures, but it is, I think, a challenging one. Asbestos can, you know, you really do want to be doing asbestos sampling correctly, and if you don't, you're simply not going to find it. It's especially challenging in these places where we have intermittent exposures. It's one reason you really want to have very sensitive sampling there. So I agree, if we do go forward to adopt, you know, the CSA goes towards making a Canadian standard, I'm sure that the folks in doing that will take a look at the best international standards as well. But right now what we have is just dozens and dozens of agencies covering off different areas of asbestos management in the different provinces. So it's a real patchwork, and it's easy to have gaps.
Thanks, Paul.
Thanks so much, Paul. We're out of time for questions, but I did give homework today. So Paul, inspired by you, I've attached the research paper from the group, the CSA group, and asked people to let us know how they'd like to see those management standards published from the CSA. And we may return to this subject matter. We're working on it, so stay tuned for that. So thank you, as always, Paul.
Okay,
Have a wonderful afternoon.